Trudy Scott here. We're back to answer some other questions and to talk about anxiety in children. And I've got Nicole Beurkens here. I'm Trudy Scott, and this is wonderful Nicole Beurkens. You just come out with a great book. Let's hold up your book and show.
Got a new book coming out, Life Will Get Better, Simple Solutions for Parents of Children with Attention, Anxiety, Mood, and Behavior Challenges. So I'm excited to talk with you about kids and anxiety and some simple things we can do.
Yes, and this is my book. For those of you that don't have my book yet, I'm sure most of you do, The Anti-Anxiety Food Solution. And we're going to be talking about zinc, and we're going to be talking about GABA in children.
Yes, let's
and
do
if you are watching us live and you've got any questions, feel free to post them below. If this is interesting, share it so more people can learn about this.
Yeah, for sure.
Great. So let's talk about zinc. Zinc is an important nutrient when it comes to anxiety, and it's a very common deficiency. Do you find that in the kids that you work with?
Yeah, absolutely. I mean, most of the children that I work with at my clinic have various neurological or mental health kinds of challenges, and zinc can be an underlying factor for many of those things. So anxiety, as you mentioned, there's also quite a bit of research to show that kids with attention and hyperactivity symptoms, ADHD kinds of issues, can have low zinc. So it's a really important nutrient to be looking at.
And you know, we're talking about kids because that's the population that you work with, but with the women that I work with, ADHD and low zinc is common as well.
Absolutely.
So whatever your age, you've got to just get to the root cause of the issue, whether it be anxiety or ADHD.
Yes.
And as we're saying, zinc is a very common deficiency, and it's depleted by stress, by sugar, by exercise. And if we're not getting enough in our diet, you're going to be low in it as well.
Right.
So at this conference, we've been doing the zinc challenge, and we've been having people use zinc sulfate to determine, as one tool to determine what their zinc status is. So let's talk about that. This is an interesting tool to assess zinc status, and it's zinc challenge. It's actually zinc sulfate. I'm going to just put this here in case you can read that. Zinc sulfate, and depending on how it tastes, it gives you an indication of your zinc status. So what we actually do, I think that's maybe do you want to do it?
Sure, yeah, absolutely.
Okay, so there you go. So what I'm going to do is just pour a small amount of the zinc sulfate, and it's just a clear liquid, in the cup, and this is the instructions that we give to folks. So what you're going to do is you're going to put it in your mouth, hold it in your mouth for 10 seconds, think about what it tastes like as it goes into your mouth, how the taste changes, and then you can go ahead and swallow, and then report back to me what you taste.
All right, here we go.
So what I'm looking at is looking at the person's face as they're doing this, and you can see from Nicole's face, she's pulling a face. It's not good. You can go ahead and swallow. Tell us what it tastes like.
I am not zinc deficient already. It tasted really, really strong right away. It kind of makes my mouth feel fuzzy, and it's got a really strong, bitter, yucky flavor to it.
So you get the prize.
Yes.
As we've been doing this all weekend, most people, and I would say 98% of the people that have come to my booth, have had no reaction or very little reaction.
Yes.
So what we're aiming for is a reaction like Nicole's, where it's really strong, you can't actually hold it in your mouth, and that means you've got enough taste. Level 1 means no taste at all, just like water. So we've had a few people say that. Level 2, no taste initially, and then they say a little bit dry, a little bit furry, a little bit sweet. That's level 2. You do need some zinc. Level 3 is bad taste initially, but not terribly bad. And then what we're aiming for is what Nicole experienced. So let me go ahead and
well, and I'll say that when I first did this, and it was actually with you, when I first did this, I was a level 1. It was just like water to me. So I've worked a lot with diet and supplementation with myself and my own health to get to the point where clearly I have enough zinc right now.
Good.
Yeah. Give you a little bit here. Okay, let's see how Trudy's zinc status is. So she's just going to hold it in her mouth, and you can see from her face that she definitely has a taste that she notices right away as well. Yeah. Swallow that. Ooh. Yeah. So what'd you notice?
Wow. Metallic.
Yes.
Just gross. I've got goosebumps all over me.
Yeah.
That's really, really horrible.
Yeah. Trudy and I clearly have zinc sufficiency at this point. We're great. We're doing great with our zinc levels. That's really good. What I'll say is that most of the kids and the young adults that we test at the clinic have a 1 reaction, maybe a 2. They're pretty deficient, or maybe they are getting what for many people would be enough, but for them and their individual needs, they don't have enough for what they need. So it's not uncommon at all for kids that we treat and their parents to have no reaction to it. They could just sit there and hold it in their mouth forever because it doesn't taste like anything.
So this is something you do with the kids that you
Yeah,
work with?
and what's
it's a cool thing for them to do.
Yes, and it really, they know right away. It's clear to understand exactly what the results show, and then it also motivates them to take the supplementation or, eat foods, that are rich in that, because they want to get their levels up. So I find that it's really simple to do even with young kids, and, easier than going and getting a lab test or something like that. It's a great tool. Yeah.
How often are you retesting? Once a week?
It depends. I mean, I don't necessarily see everybody once a week in the clinic, so every few weeks, and I'll periodically test with people too. Sometimes they get their level up, and then, we'll look at it maybe 6 months down the road to kind of see if we're holding or where we're at with that.
Yeah, like you described, initially yours wasn't
Right.
good, and now you're seeing it.
Exactly.
So it's
Yeah.
good to do it periodically. And I want to just share something that I found very interesting here at this conference is a lot of people came up and said, I'm taking zinc. Why am I not tasting it?
Yeah.
And we went through some of the reasons as to why it may be low, even if you are taking it, you expect it. I mentioned the stress and the sugar and the exercise, but some other factors are low hydrochloric acid production. That's going to be a factor. And then the other big factor that I saw this weekend, which is so interesting, is I said to people, what's your diet? Are you on a gluten-free diet and a GATS diet or a paleo diet and consuming a lot of nut flours, a lot of baked goods made from nut flours? Nuts are high in copper, and zinc and copper balance each other out. So if you are consuming high amounts of copper from nuts, that could be affecting your zinc status. So it's something to be aware of and making sure that your diet isn't affected.
That is a great point. And another thing that I see too is looking at the quality and the amount of supplementation. Because sometimes people will say, well, I'm taking zinc, so why isn't my level higher? Well, if you're taking something that you got, off the shelf at maybe a mass grocery store or something like that, it may not be good quality, it may not be very absorbable. So I think that's another area too that people need to look at.
Yes, and then the other thing related to that is there copper in your zinc product? If you're getting just a straight zinc product and it's also got copper in, that could be problematic. And then for my clients who have the anxiety and the pyroluria, which is the social anxiety, and they need higher levels of zinc on an ongoing basis, I will recommend a copper-free multi because that copper is going to negate the wonderful effects that you're getting from the zinc.
It's a great point.
Yeah.
Absolutely. Absolutely.
Great.
All right, so that's zinc.
GABA?
You want to talk about GABA next?
Yes.
Show one of my favorite products here.
One of my favorites too.
Yeah, this is one that Trudy introduced me to and has been so useful for the kids that I work with because GABA can be such a great tool for calming, especially for some of the children and the young adults that I see who tend their anxiety can escalate pretty quickly and can kind of work towards panic for them. And GABA is a really nice tool, especially this one, this GABA Calm formulation. It's a lozenge. You just suck on it, so it's very easy for kids to take. They don't have to swallow a capsule. Yeah, this is what it looks like. It's small. They have orange and peppermint flavors. And I will tell you, I personally really like the peppermint one, but it's very strong, like an Altoid mint. So if you or your child aren't really into strong peppermint flavor, probably the orange. I would say most of the kids in the practice like the orange.
I like the orange.
Yeah. But you just suck on it, and you can hold it in your cheek and just suck on it and let it dissolve, and it starts working very quickly. And so I can work with kids and with young adults too when they start to feel like their anxiety's ratcheting it up. Maybe they start to feel tension or they're just starting to feel anxious in a certain situation. They can use one of these to help bring them back down. The dosing on this is really nice. It's got 125 milligrams of GABA in it, and that's a really nice dose, even for younger Kids, you can cut the tablet in half if the child is, quite young or very small for their age, and it just works really effectively for a lot of the people that I work with.
That's great. And I find the same with the women that I work with. So no matter what your age, if you have the low GABA symptoms, which is the physical tension, more in your body, you're often my clients feeling it in their shoulders. So they'll be sitting there sort of tense, and as they take the GABA, they'll just say, oh, my shoulders feel so relaxed. And one of the clues for adults is, are you coming home from work at the end of the day saying, I need a glass of wine, I need something to de-stress, and it may be that you've got low GABA and you're using that wine as self-medication to feel calmer and to de-stress. The GABA is absolutely amazing. And my clients will just have it in their bag with them. When they're out on the road, it's easy to take. And I've worked with moms with kids, and they'll pop one and they'll give one to their kids.
Absolutely.
And it's amazing. One of my favorite stories is a mom who was actually, I interviewed her on one of the anxiety summits. Her and her family all have Lyme disease. And this has been amazing for her daughters who have the Lyme anxiety. So they're dealing with the Lyme, working with the doctor to help get rid of the infection. But in the meantime, the GABA is eliminating the anxiety, because so many of these kids with Lyme disease get put on benzodiazepines. And why not use something like GABA? It's just amazing.
And that's exactly right. So many kids come into my clinic on all kinds of medication. For anxiety is a big one, and especially if they have some symptoms of panic, it's very common that they're put on something like Xanax or Ativan or Valium or something like that. And there are so many other tools that we can and should be trying first. You and I would say we would want to do anything else to avoid, using those medications, but this is a nice tool, and for some of the people that I see who have been on those benzodiazepine medications or are currently taking them, this can be a nice way to sort of help them to find a different approach for that. And sometimes what I'll even say is, if you're in a situation where typically you would reach for, your Ativan or your Klonopin or something like that, try taking something like a GABA calm. Wait 10 minutes, 15 minutes, just kind of see how you feel. And then if you still feel like you need to take your prescription, well, it's been prescribed to you, go ahead and do that. But what I often find is that this can take the edge off enough that they feel more in control again, they feel more relaxed, and they can just go on with their day.
And I think something that I'd like to clarify here is a lot of people will say to me, my anxiety is so severe, or my depression is so severe, there's no way food or nutrients could have an impact. And I really want to emphasize that they absolutely can.
Yes.
No matter how severe it is, there is likely a nutritional solution that, even if it just has a slight effect, it's going to help.
Right.
But don't discount the power of these nutrients and these amino acids.
Yeah, I agree.
And then I want to ask you a question about kids being prescribed benzodiazepines. So it just horrifies me. Tell me a little bit about what you've seen and your thoughts on it.
Yeah, typically when we're seeing kids in the practice, especially if they've had symptoms of anxiety or depression, it's very common that they've been prescribed SSRI kinds of medications, your Prozac, your Zoloft, those types of meds. But for kids and young adults who they continue to have symptoms on those, it's not uncommon at all for them to be prescribed benzodiazepines, particularly in the teen and the young adult years. And what becomes so problematic with those is that you develop a dependence on them. And so then what we end up with is, by the young adult years, these young adults coming in who they're not feeling particularly good with taking these meds. They're really not addressing their symptoms anymore, but they're struggling to not take them because they feel worse when they don't take them. So they have to take them just to be able to function, but they're not really getting great benefit from them anymore, but they feel like they can't get off of them. And these are some of the real challenges that I try to help families and kids avoid by giving them other options to avoid these meds in the first place. But when I get these patients in who are already taking these, it becomes a real process that can sometimes take years of collaborating with their prescribers, with their physicians and with their family to help reduce those medications by improving symptoms with other kinds of approaches. And you really have to be patient, and it takes time. But I would absolutely second what you said about the fact that nutrients are powerful. They're an incredibly important part of symptom reduction and of the healing process for people, and we shouldn't underestimate the power that they can have.
Absolutely.
Yeah.
And I think it's unfortunate because when someone has an issue, they go to their primary care doctor or they go to some doctor who just doesn't know about these
Right.
options that
That's
we're talking about.
That's right.
And they prescribe these medications without being cautioned.
Right.
Benzodiazepines are meant to be used short term, 2 weeks, and people are on them for years, and then they have all
Yeah.
these issues
That's
that
right.
we're talking about.
Yeah.
So just be aware that there are these other options, and you don't have to use these medications. It's World Benzo Awareness Day, actually, was July the 21st this year, because there are so many people in so much trouble. And unfortunately, a lot of conventional doctors are not even aware of the problems that we are seeing with people using these medications.
Yeah.
So we really need to just be educating people. Quite frankly, I don't think anyone should ever be prescribed them. If something like GABA can give you the kind of results that a benzo can, why even go to a benzo in the first place?
Right. And I think that's what's been so encouraging to me, being at this conference, this Integrative Medicine for Mental Health conference this weekend. It's been really encouraging to see so many physicians here, so many psychiatrists and family practice physicians and other kinds of specialty physicians who really are interested in learning more about these kinds of approaches, and who are saying, they're seeing the same things we are about the problems that come up with these medications, and they're looking for knowledge and information about how to approach these problems differently. And that's really exciting to me, and it's been fun to be around this group of people where professionals are just wanting to soak in this knowledge. So I think the pendulum is starting to swing.
It is.
Yeah.
And that's such a good point, because I was just amazed at how many people have been using food and nutrients. Psychiatrists, DOs, nurse practitioners, psychiatric nurse practitioners that are just, some of them have been using some of these approaches for years and seeing great results. Others are just new to this field, and they're so excited about the possibility, because as you said earlier, they're not seeing the results with the medication, or they're seeing patients who are having bad results. So a conference like this is amazing. So we really appreciate the Integrative Medicine for Mental Health conference. If you haven't been to it, and if you're a practitioner, this is the conference to attend, to meet other like-minded practitioners, and then to hear some great presenters, and the vendors have been incredible as well.
And it happens every September.
Yeah.
And I think it's a great event, and certainly if you are a practitioner and you're interested in learning more about this, definitely plan to be here next year. It's a really great event.
And if you're not a practitioner, talk to your doctor about it and send them, because they will be blown away. It's quite amazing.
Yeah.
So if you've got any questions, post them below in the thread, and we'll come back and answer them.
Yeah.
We're not quite sure how to answer them while we're doing this live.
We're new to Facebook Live, so we're still figuring it out.
But we've had fun. I hope you've enjoyed it as well, and post your questions below, and we'll come back and do some more.
Absolutely. Yeah.
Thanks, Nicole.
Thanks, Trudy.